Hello, everyone, and welcome to Access at Risk, Innovation for Health Equity in a Time of Uncertainty. I'm Gwen Darien. I'm the EVP of Patient Advocacy, Engagement, and Education at the Patient Advocate Foundation. As we were thinking about this, as we were planning for this Innovation Summit, we knew that we were in a time where there was great access to risk. And every day it seems every day something changes. Every day access is even more at risk. And what we're doing is so incredibly timely. And we are going to, I hope that you will find as much both both energy and inspiration, as well as reality. We're trying to look at this in a very clear-eyed way as we go through this Innovation Summit today. This is our Spring 2026 Innovation Summit. And there are some themes that I think that will run through all of this Innovation Summit. As I was thinking about the introduction and what I was going to talk about and what we were going to talk about before we started this extremely rich and robust and thought-provoking and thoughtful day, I was thinking about some of the aspects of what some of our core principles are, and what is driving this Innovation Summit. And I was thinking back to an article that Donald Burbick wrote in 2020, right as we were in the middle of the pandemic, where he talked about the moral determinants of health. And I think the moral determinants of health are what drive everything that we do. They are one of our core principles at PAF, and I think the core principles for most people who are on this, for everybody who is on this event, because we have to embrace, as Dr. Berwick says, the moral determinants of health that include, most crucially, a strong sense of social solidarity in the United States. And one of the things we're going to talk about as we go through the day, is how we embrace that strong sense of solidarity and what that means, and what the risk of fragmentation is if the solidarity is fragmented. I was also thinking about, we often talk in these events about social determinants of health and structural determinants of health. But we don't often think about political determinants of health, and that policy and political determinants of health underlie what we talk about, but we don't often put them in the forefront. And Dr. Aletha Maybank wrote a piece that just came out in Health Affairs, where she talked about how she and her co-authors talked about how every policy is health policy. Housing policy is health policy. Climate policy is health policy. Economic policy is health policy. And as she says, it may seem obvious, but our laws and regulations are rarely developed with this in mind. And this is something we'll hear a lot about from Mr. Daniel Dawes, who is our keynote speaker, is what are those political determinants of health, and what is our role in ensuring that every policy is health policy, and everything we do contributes to the health and care of our fellow citizens, our communities, our families. And the other thing that I think that we consider and think about is that health equity is both a process and an outcome. And we can never stop thinking about it as a process. We can never, because if we stop thinking about it as a process, we won't have equity as an outcome. And it isn't an encyclopedia. It isn't a book that we write and put on the shelf, but it's something that we have to enact every single day. And one of the other themes that you'll see throughout today is that hope is an action. And there are there's a multitude of ways to take action, from small hyper-local action to federal action, to action within families and communities. And we can take action in the ways that are appropriate to us. And I hope that as we are going through the day, you will see yourself in some of these solutions and in some of these actions that you'll hear about from our speakers and from our panelists. So I wanted to go through the agenda and really talk about it as it relates to one of PAF's core principles, which is centering what matters, aligning action with individual and community health goals. So I think one of the things we're doing this time, which we have not done in the past, is that in order to really model and model what we say, what this idea that we are aligning actions with goals and centering goals that matter with people, we are going to ask you to help us formulate our call to action at the end. There are going to be a series of polls. There are going to be a series of questions. Some of them will be one-word answers. Some of them will be ranking, and some of them will be free text. And so that at the end of this agenda, we will talk about. My colleague Jamie Trotter will do a call to action that's based on what you have told us is important to you, because it's really critical as we move forward that we're able to align with what is important to the people in this room, the people that we love, the people that we live with. And so as we think about the agenda, we have a very rich agenda that has many different perspectives and many different aspects of what we're doing and what people are doing out in the community. So we'll start with a keynote by Daniel Dawes. I'll introduce that in a minute after I've gone through the agenda. And then we're going to have an audience poll. We also have, as we have in the past, we will have a series of stories that we will share throughout the course of this Innovation Summit. So we've recorded video stories where people talk about their lived experience and their concerns and their actions to ensure that their access is not at risk. Our second panel is, our first panel is about civic engagement for healthier communities. So we'll talk, my colleague Caitlin Donovan is the moderator of that panel, and we'll talk with people who work in very different places in civic engagement and what that means and how we can work together to really make change from very local levels to statewide levels. We have another polling session, and then we have another story excerpt by Valerie Worthy on church, community, and care, rebuilding safe havens for health. We have another polling session, so please, we encourage you to participate in this polling question, because the more that we get from you, the more relevant our call and salient our call to action will be. And then the next panel is moderated by our colleague Ashley Freeman, Beyond the Visit, Delivering Care Patients Need and Deserve. And as we all know, and as we all believe, the health and healthcare do not simply take place in the clinical encounter. Most of health and healthcare is beyond the visit. So when we think about our healthcare workforce, we think about it in a very broad way. This panel has a nurse, a community health worker, and a community physician, who will also talk about what that means to be a community physician. We have our final story is by Kelly Rand, who will talk about when access isn't enough, how systems shape the care we receive. And then Jamie Trotter will do our call to action from our audience polling.